Hello grade 8 students, I am Melissa Garces, your MAPEH teacher. I hope that you are ready to learn more about our lesson for today. But before we begin, let's pray first and feel the presence of our Lord.
Our loving and generous God, we praise and thank you for the bountiful blessings you have given us. Thank you for giving us a mind that can know and a heart that can love. Thank you for giving us the chance to continue learning amidst the pandemic that had caused a lot of changes in our lives. We are sorry for the times we have failed you. We humbly ask for your forgiveness. Father, help us stay focused on our studies. When learning becomes difficult, grant us the gifts of courage and enthusiasm. Grant us the grace to use our knowledge in making a difference into the lives of the people around us. All this we pray in your mighty name. Amen.
Today, we will talk about pregnancy-related concerns. At the end of this video lesson, I am certain that you will be able to
defines basic terms related to pregnancy concerns, enumerates the risks or consequences of teenage pregnancy, appreciates the importance of being physically, mentally, and financially ready before having a child.
Do you have your notebook and pen with you? You may write terms and information. Let us start by playing a word hunt. I hope you are ready. Let's begin.
Search for 5 words that you can find from the box. It could be a diagonal, horizontal, or vertical. You may write your answers in your notebook. Your time starts now. Time is up. Alright, now let us figure out what are the words that we can find in the box. We have the words fertilization, care, implantation, pregnancy, and teenager.
You were a keen observer. Good job! You were able to find the 5 important words that we will encounter all throughout our lessons about pregnancy-related concerns. While you are actively listening and watching the discussion, here are your guide questions. How human reproduce? How is the process of reproduction? How does a fetus develop inside a woman's womb? Okay, I think you are ready to learn. Let's start! After marriage, a couple's desire is to build a family. Humans are reproduced through sexual reproduction. In this kind of reproduction, the reproductive cell of man and woman join together to make a new cell. The process is called fertilization. Fertilization is a reproductive process wherein half of the genes of the father and the mother combine together to form a single cell. The new cell then divides to form more cells. This ball of cells enters the uterus and attaches itself to the uterine wall. The attachment of the developing cells of the uterus is called implantation.
Pregnancy is the term used to describe the period in which a fetus develops inside a woman's womb. Pregnancy usually lasts about 40 weeks or just over 9 months as measured from the last menstrual period to delivery.
Did you find the answers of the questions given earlier? Very good. You are really paying attention in our discussion. Now, let me ask you another question. Can a homosexual couple and a single person can have their own flesh child? Can a human reproduce without sexual intercourse? Great! You got that right. The answer is a big yes. But how is that possible? Now, to further explain that, there is a clip on how a homosexual and a single person can have their own flesh child.
In 1978, Louise Brown became the world's first baby to be born by in vitro fertilization, or IVF. Her birth revolutionized the field of reproductive medicine. Given that approximately 1 in 8 heterosexual couples has difficulty conceiving, and that homosexual couples and single parents often need clinical help to make a baby, the demand for IVF has been growing. IVF is so common that more than 5 million babies have been born through this technology. IVF works by mimicking the brilliant design of sexual reproduction. In order to understand IVF, we first need to take a look at the natural process of baby making. Believe it or not, it all starts in the brain. Roughly 15 days before fertilization can happen, the anterior pituitary gland secretes follicle-stimulating hormone, FSH, which ripens a handful of follicles of the ovary that then release estrogen. Each follicle contains 1 egg, and on average, only 1 follicle becomes fully mature. As it grows and continues to release estrogen, this hormone not only helps coordinate growth and preparation of the uterus, it also communicates to the brain how well the follicle is developing. When the estrogen level is high enough, the anterior pituitary releases a surge of luteinizing hormone, LH, which triggers ovulation and causes the follicle to rupture and release the egg. Once the egg leaves the ovary, it is directed into the fallopian tube by the finger-like fimbriae. If the egg is not fertilized by sperm within 24 hours, the unfertilized egg will die, and the entire system will reset itself, preparing to create a new egg and uterine lining the following month. The egg is the largest cell in the body and is protected by a thick extracellular shell of sugar and protein called the zona pellucida. The zona thwarts the entry and fusion of more than 1 sperm, the smallest cell in the body. It takes a man 2 to 3 months to make sperm, and the process constantly renews. Each ejaculation during sexual intercourse releases more than 100 million sperm. but only 100 or so will ultimately make it to the proximity of the egg, and only one will successfully penetrate through the armor of the zona pellucida. Upon successful fertilization, the zygote immediately begins developing into an embryo and takes about 3 days to reach the uterus. There, it requires another 3 or so days to implant firmly into the endometrium, the inner lining of the uterus. Once implanted, the cells that are to become the placenta secrete a hormone that signals to the ovulated follicle that there is a pregnancy in the uterus. This helps rescue that follicle, now called the corpus luteum, from degenerating as it normally would do in that stage of the menstrual cycle. The corpus luteum is responsible for producing the progesterone required to maintain the pregnancy until 6 to 7 weeks of gestation, when the placenta develops and takes over until the baby is born approximately 40 weeks later. Now, how do you make a baby in a lab? In patients undergoing IVF, FSH is administered at levels that are higher than naturally occurring to cause a controlled overstimulation of the ovaries so that they ultimately produce multiple eggs. The eggs are then retrieved just before ovulation would occur, while the woman is under anesthesia through an aspirating needle that is guided by ultrasound. Most sperm samples are produced by masturbation. In the laboratory, the identified eggs are stripped of surrounding cells and prepared for fertilization in a petri dish. Fertilization can occur by one of 2 techniques. In the first, the eggs are incubated with thousands of sperm, and fertilization occurs naturally over a few hours. The second technique maximizes certainty of fertilization by using a needle to place a single sperm inside the egg. This is particularly useful when there is a problem with the quality of the sperm. After fertilization, embryos can be further screened for genetic suitability, frozen for later attempted pregnancies, or delivered into the woman's uterus via catheter. Common convention is to transfer the embryo 3 days after fertilization, when the embryo has 8 cells, or on day 5, when the embryo is called a blastocyst and has hundreds of cells. If the woman's eggs are of poor quality due to age or toxic exposures or have been removed due to cancer, donor eggs may be used. In the case that the intended mother has a problematic uterus or lacks one, another woman, called a gestational carrier or surrogate, can use her uterus to carry the pregnancy. To increase the odds of success, which are as high as 40% for a woman younger than 35, doctors sometimes transfer multiple embryos at once, which is why IVF results in twins and triplets more often than natural pregnancies. However, most clinics seek to minimize the chances of multiple pregnancies, as they are riskier for mothers and babies. Millions of babies, like Louise Brown, have been born from IVF and have had normal, healthy lives. The long-term health consequences of ovarian stimulation with IVF medicines are less clear, though so far, IVF seems safe for women. Because of better genetic testing, delayed childbearing, increased accessibility, and diminishing costs, it's not inconceivable that artificial baby making via IVF and related techniques could outpace natural reproduction in years to come.
Can you still follow? If not, don't be shy to pause and replay this video for you to catch up, okay? Now, I want you to enumerate 5 risks or consequences of teenage pregnancy. You may write your answers in your notebook. Great job! Now let's find out some of the risks or consequences of teenage pregnancy.
Most teenage girls don't plan to get pregnant, but many of them get pregnant eventually. Teen pregnancies carry extra health risks to both the mother and the baby. They have a higher risk of pregnancy-related high blood pressure and its complication. Risks for the baby include premature birth and low birth weight. Many pregnant teens drop out of school and some never complete their education. A couple with little education and multiple children to care for will find it very difficult to earn a living, especially for those who are not supported by their parents and friends. Other effects of induced illegal abortion of pregnancy can result in long-term psychological effects on teens, which include depression, post-traumatic stress disorder, guilt feelings, sleep problems, and anxiety disorder.
Well, what are the changes in the mother's body? How a mother's body works when bearing a child?
Muscles and joints shift and jostle. The heart's pounding rhythm speeds up. Blood roars through the arteries and veins. Over the course of a pregnancy, every organ in the body changes. Ignited by a range of hormones, these changes begin as soon as pregnancy begins. Just days after fertilization, the embryo implants in the lining of the uterus. Because its DNA doesn't exactly match the mother's, the immune system should theoretically recognize it as an invader, attack and destroy it, like it would bacteria or other harmful microbes. That's the challenge. The mother's immune system needs to protect both her and the fetus, but can't act as it usually does. What happens is not as simple as decreasing the immune response. Instead, it's a complex interaction we're just beginning to understand, involving many different types of immune cells, some of which seem to protect the fetus from attack by other immune cells. The body also creates an antibacterial plug made of mucus on the cervix, which keeps germs away and stays sealed until labor. As pregnancy progresses, the uterus expands upward and outward with the growing fetus. To make room, hormones called progesterone and relaxin signal muscles to loosen. The muscles that propel food and waste through the digestive tract also loosen, which makes them sluggish, causing constipation as passage through the tract slows down. Loosened muscles at the top of the stomach might allow acid to escape into the esophagus and throat, causing heartburn and reflux. These changes can worsen morning sickness, which is caused in part by the hormone HCG, and can also happen at other times of day. As the uterus grows, it pushes on the diaphragm, the muscle that expands and contracts the chest with each breath. This limits the diaphragm's range. To compensate, the hormone progesterone acts as a respiratory stimulant, making the pregnant woman breathe faster so both she and the baby can both get enough oxygen with less lung capacity. This all may leave the pregnant woman feeling short of breath. Meanwhile, the kidneys make more erythropoietin, a hormone that increases red blood cell production. The kidneys also keep extra water and salt rather than filtering it out into urine to build up the volume of the blood. A pregnant woman's blood volume increases by 50% or more, but it's also a bit diluted because it only has 25% more red blood cells. Usually, the body makes blood cells using iron from our food, but during pregnancy, the fetus is also building its own blood supply from nutrients in the mother's food, leaving less iron and other nutrients for the mother. The heart has to work extra hard to pump all this blood through the body and placenta. A pregnant woman's heart rate increases, but we don't fully understand how blood pressure changes in a healthy pregnancy, an important area of research, because some of the most serious complications are related to the heart and blood pressure. The expanding uterus may press on veins, causing fluid buildup in the legs and feet. If it presses on a large vein called the inferior vena cava, it might interfere with blood returning to the heart, causing a dizzying drop in blood pressure after standing for too long. Some of these changes start to reverse even before birth. Shortly before delivery, the fetus drops down, decreasing the pressure on the diaphragm and allowing the pregnant woman to take deeper breaths. During labor and birth, much of the extra fluid in the body is lost when the water breaks. The uterus shrinks back down in the weeks after birth. Like the rest of the body, pregnancy affects the brain, but its effects here are some of the least understood. Recent studies show differences in the brain scans after pregnancy and early parenting and suggest that these changes are adaptive. That means they could help with parenting skills, such as an increased ability to read facial cues since babies can't talk. The lack of information about pregnancy's effects on the brain highlights a general truth. Historically, almost all the research around pregnancy has focused on the fetus rather than the pregnant women. Experiences of pregnancy vary widely, both within the range of healthy pregnancies and due to complicating health conditions. New research will help us understand why and develop effective treatments where necessary. In the meantime, every pregnancy is different, and it's important to consult a doctor with any specific questions.
Now, we have here the phases of pregnancy. A human pregnancy lasts approximately 40 weeks from the first day of the pregnant person's last menstrual period. A pregnancy is divided into 3 segments called trimester. Each trimester includes some common symptoms and milestones. During the first trimester from week 1 to week 12, a pregnant person may experience morning sickness. Morning sickness can cause nausea and vomiting. For some, it happens in the morning, but for the others, they may feel nauseous all day long. Eating dry crackers such as saltines can ease the nausea. Other symptoms of pregnancy during the first trimester include feeling tired, becoming sensitive to certain smells, craving particular foods, experiencing swollen and tender breasts, and needing to urinate or pee more frequently than usual. The second trimester of pregnancy begins in week 13 and runs through week 26. By the beginning of this trimester, most fetuses will have grown into about the size of the peach and will weigh approximately 1 ounce. Stage of pregnancy, a healthcare professional often can tell the sex of a fetus with some degree of certainty. During this trimester, a pregnant person will gain a little amount of weight. They may also experience nasal congestion, dizzy spells, leg cramps, groin pain, and back aches. Many pregnant people also begin to develop dark patches on the skin of their abdomen or face. These spots usually fade right after giving birth. It is during this trimester, usually between the 16th and the 25th week, that a pregnant person may begin to feel movement inside their uterus. By the end of this trimester, the fetus will have grown to about the size of a cantaloupe and will weigh a little more than 1 pound. The third trimester begins at week 27 and lasts until the persons give birth, which is usually around the 40th week. In this, the last trimester of pregnancy, the fetus grows rapidly, gaining weight and developing each week. This stage of pregnancy may cause discomfort for the pregnant person as the uterus stretches even further to accommodate the growing fetus. The pregnant person also may experience shortness of breath and heartburn and may find that they have trouble in sleeping. In this, the third trimester, some people experience false contractions or cramps. These are practice contractions known as Braxton Hicks contractions. True labor contractions usually begin a few weeks or days before childbirth. They are more regular and more predictable than Braxton Hicks, and they grow closer together and stronger over time. Strong regular contractions are a sign that labor has begun.
Alright, I hope that you were able to note the important information. Now that you are already familiar with the pregnancy-related concerns, let's try to test your learning by answering some questions. Copy the link on your web browser and accomplish with cool honesty the quiz. So good luck everyone!
For your assignment, try to dig deeper as you read the lyrics of the song Pugoy ng Duyan by Lea Salonga. So these are the guide questions. What do you think is the theme of the song? How can you show the importance of your mother in your life?
It is indeed another productive day. I bet you are now aware of the different pregnancy-related concerns and the consequences of being a teenage parent. Thank you for joining me in our lesson for today. This is Ma'am Melissa, your MAPEH teacher. Until next time, goodbye!